Your contribution to neurotology is very well known. Professor Strupp, please tell us what's the role of genetic testing in neurotology today?
So today, except patients with episodic ataxia, it's very, very limited. In the future, it might be of interest. First, for instance, in patients with downbeat nystagmus, because we just identified genes in this disease which are related to the function of Purkinje cells. Another area of interest might be Meniere's disease, to have probably a more specific treatment. And finally, we currently look at Meniere's disease patients to find out by genetic testing how much beta-histine they need to become free of attacks.
What's the perspective of pharmacotherapy in the future?
Well, we still need state-of-the-art placebo-controlled trials. This is true for Meniere's disease. This is true for vestibular migraine, for vestibular paroxysmia. So there's still a lot of work to be done. And secondly, one study is not enough. Normally you need 2 big trials to convince the community and also the Cochrane review group.
Which questions you think that neurotology will answer in the future?
I think most of the questions are already answered. So we know how to diagnose the diseases. A major progress is the classification of vestibular disorders, on the one hand for the clinicians, on the other hand for clinical trials, because then you have standardized criteria which should be used by every doctor. So most of the things are done, in particular for the patients, but there's a huge deficit in the skills and knowledge of doctors, general practitioners, ENT and neurologists. So we have to spread our knowledge, and then we will improve the function and quality of life of our patients. And I think that's very important.
Thank you very much.
You're welcome.